Hello, my name is Dr. Melanie Bourgeot. I am a fourth-year pathology resident at Emory University, and in this video, I'm going to be going over another challenging soft tissue pathology case for new trainees. If you want to view these cases for yourself, you can find links to the digital slides in the video description. This is a representative section of a large retroperitoneal mass abutting the pancreas of a 53-year-old male. At low power, I can see this is a relatively circumscribed mass, although there is some infiltration into the adjacent adipose tissue. Even at this low power, I can tell that this lesion is composed of markedly atypical cells within a myxoid to fibrous stroma. Some areas, like here, the cells are embedded in a myxoid stroma with prominent vasculature. Other areas, like this one here, are more collagenous and hypercellular, and you can make out a vague fascicular arrangement. Looking more at the cells themselves, you can see that there's really a spectacular amount of atypia, with pleomorphism, hyperchromasia, irregular nuclear membranes, coarse chromatin, and even multinucleation. Mitotic figures, including atypical ones, are easy to find, such as this one right here. This is an example of well-differentiated liposarcoma. But before we get into that, let's talk about its well-differentiated counterpart. Here is an example of well-differentiated liposarcoma. Key features include lobules of mature but variably sized adipocytes separated by thick fibrous bands containing atypical stromal cells. Lipoblasts, like this one right here, may be present but are not required for diagnosis. These tumors commonly arise in the retroperitoneum and deep soft tissues of the extremities in middle-aged and older adults. Cases of well-differentiated liposarcoma arising in the extremities are called atypical lipomatous tumor due to their lower rate of dedifferentiation, which is thought to be as low as 2% in atypical lipomatous tumor and as high as 20% in well-differentiated liposarcoma. This lower rate of dedifferentiation ultimately results in a better prognosis, which is likely due to the fact that negative margins are easier to obtain. One variant of well-differentiated liposarcoma to be aware of is the sclerosing variant. As the name suggests, this subtype is composed predominantly of atypical cells within a collagenous to sclerotic stroma. The adipocytic component is often present, but usually scant. These lesions can be incredibly hypocellular, with atypical stromal cells being few and far between. Switching back to dedifferentiated liposarcoma, up to 90% of cases arise de novo, with the other 10% arising within a pre-existing well-differentiated liposarcoma. Just like well-differentiated liposarcoma, the most common sites are the retroperitoneum and the deep soft tissues of the extremities. In addition, both well-differentiated and dedifferentiated liposarcoma have amplifications of the 12q13 through 15 region, which includes MDM2 and CDK4. The morphology of dedifferentiated liposarcoma is extremely variable, including within the lesion itself. This case here is an example of the high-grade myxofibrosarcoma-like morphology. Other patterns include morphology similar to undifferentiated pleomorphic sarcoma, leiomyosarcoma, and synovial sarcoma. Heterologous differentiation, such as osteosarcomatous or chondrosarcomatous differentiation, may also be present. Rarely, homologous differentiation can occur, with areas resembling pleomorphic liposarcoma. However, dedifferentiation is not always high-grade, with marked atypia, hypercellularity, and brisk mitotic activity. Some cases of dedifferentiated liposarcoma are deceptively bland, with relatively uniform spindle cells in a fascicular, storiform, or whirling pattern. Low-grade dedifferentiated liposarcoma may resemble a low-grade spindle cell neoplasm, such as low-grade fibromyxoid sarcoma, or even fibromatosis. Here is a nice example of low-grade dedifferentiation in a well-differentiated liposarcoma. On the left, you can see areas of clear, well-differentiated liposarcoma. However, there is widening of the fibrosepta. On the right side, you can see a near complete loss of the adipocytic component, accompanied by an increase in stromal cellularity. Before I wrap up this video, here are a couple of take-home points. First, since the majority of retroperitoneal sarcomas are liposarcomas, it is essential to rule out dedifferentiated liposarcoma if you have a sarcoma in that location. Second, because it portends a worse prognosis, you must thoroughly evaluate cases of atypical lipomatous tumor and well-differentiated liposarcoma for foci of dedifferentiation. Because these tumors are usually quite large, proper sampling is important in identifying areas of suspicion. And that's all I have for now. Please like and subscribe and stay tuned for my next video. Thanks for watching!